Thank you very much. Muito obrigado. Eu, na verdade, falo português, mas me pediram para falar inglês. É com muita pena que vou falar em inglês, porque eu posso falar português. Um, Let me start by just position a little bit where we are in relation to the digital transformation of healthcare sector. First of all, we have to recognize and accept, and also all the data indicates that health is behind the digitalization compared to many other sectors, compared to transport, compared to education, e-government, and others. So we need to accelerate that. So the COVID-19 pandemic made us realize the need to accelerate the transformation of health to the digital age. But also then within that transformation, we have to recognize and consider the fact that only a little more than half of the world is connected to the broadband. So when we talk about leveraging on digital to provide health and well-being, we are actually talking about half of the world. So therefore, to move forward, as we progress in this transformation, we want to leverage on the capacities of other entities that will help us bring those people that are not connected to the connected world. I'm from Mozambique. So in Mozambique, more than half, only 17% of the people are connected. So there is in Africa it has a lot of segments of populations that are not connected. So let's keep that in mind. Now, that will not stop us to deliver on the strategy and transform health to a digital age. So in last year, the World Health Organization in all the member states approved the global strategy on digital health. It's a 5-year strategy with a vision to improve health for everyone, everywhere, and accelerate the development and adoption of appropriate health and digital health solutions to achieve all the sustainable development goals, targets that we set to ourselves, which needs to be achieved by 2030. So that's at the center of the global strategy on digital health. And if you want to look at it, so just if you Google global strategy on digital health, you will find it. Can you hear me now? Yeah. So so let me talk about the 4 strategic objectives of the global strategy on digital health. The first one is to promote the global collaboration and advance the transfer of knowledge on digital health. Global collaboration is what WHO has been asking governments even during the pandemic. That global collaboration is required to really bring the expertise of the tech giants and the expertise of the health and life science to leverage on these 2 distinct areas, but to bring that to make sure that we do not harm in terms of health principles, but also we accelerate that transformation using the collaboration. The second objective is advanced implementation of national digital health strategies. Because we can talk about global collaboration, but we need to make sure that it reaches everyone where they are, in their village, in their families, in their communities. And that requires a national strategy. But a national digital health strategy cannot work in isolation. It has to be part of the health strategic plan of a country. So we want to see that, and we are promoting countries to move in that perspective, and a number of countries are working with us in that front. But we have to recognize each country has a different state of maturity on digital. Some are quite advanced. If you talk about Europe, there's a level of advance on digitalization of healthcare sector. But if you talk about developing countries or least developed countries, we need to invest in infrastructure. So the type of intervention and investments will differ from country to country, and we're working with countries on that in that front. The third objective is strengthen governance on digital health at global, regional, and national level. Let's talk about health data, for instance. Let's look at what tech companies, the tech giants, are doing. They monetize on data. And what is the principle on health and life science is to donate blood, organs. You donate. You don't monetize on those things. So to bring these two principles together of monetization of data, which is very much at the core of the tech giants, and the principle of donation, which is part of the health and life science, we need to really strengthen that governance, making sure that ethical principles, privacy is at the center of the whole transformation. The strategic objective number 4 is advocate people-centered health systems. And I give you an analogy on that. If you look at the tourism and the hospitality, you have a component where the people-centered approach allows anyone that travels around to actually rate a hotel, rate a restaurant, to rate everything, where people can just say, yes, I like that because people rated highly and I go there. If you take that analogy, bring into the health sector, where a people-centered approach is needed, patients and people that interact with health systems should be able to actually provide a feedback mechanism that will allow us to improve the services that we deliver through technology, be it artificial intelligence, be it blockchain, or any other technology that we implement. So what is in addition to these 4 objectives in the global strategy on digital health, we have 172 actions where the member states agreed that together WHO has to perform some, member states have to perform others, and other partners have to perform some other actions that are included in the global strategy on digital health. These 172 actions are divided in short term, mid term, and long term. But if I talk about a dream, and if you ask me what is my dream, I will just bring the other analogy of the banking sector and financial sector. 20 years ago, no one could process any transaction in a bank without actually going to the branch. And today, in health sector, you can't benefit for health services without necessarily going to a hospital or a clinic. So the transformation of health into a digital age require us to ensure that the digital to digital interaction happens same way that digital to digital interaction is happening today in the financial sector. So at WHO, we are working with a number of partners. We benefited from a number of private sector interventions last year to support that digitalization of WHO to start with. WHO needs also to digitalize, but also to support a number of areas that the sector of health can gain advantage, especially on areas that already mature. And I will talk about just one technology before I end my intervention. Telehealth, telemedicine is already a very matured area, and yet policies are preventing the whole world to leverage in this technology, let alone artificial intelligence within the telehealth and telemedicine. We had the pandemic situation where countries in Europe, where health systems were at the brink of collapse, and neighboring countries within Europe could actually support those countries, especially those patients that have non-communicable disease that couldn't go to a hospital because the hospitals were overwhelmed with the COVID patients. So we need to change policies, address policies to allow global practice of medicine, to allow cross-border practice of telehealth and telemedicine in a way that we can really deliver health in a very remote area. And if I talk about Mozambique, my own country, telehealth and telemedicine will allow Mozambicans sitting in a very remote areas to actually be able to see a specialist that would help address the specific disease. And we have the whole goal of eradication of cervical cancer, and digital health is key component there. So we are working with the teams that and some innovations around that front. So to conclude, the digital transformation of health and the WHO and global digital health strategy and its implementation require not just WHO to reinvent itself, to recreate itself and transform itself. It requires all of us in our individual sectors to come together to leverage on this technology, but also mitigate all the risks, privacy and ethics to transform the sector to a digital age. So health in the digital age is what we call today, but 10 years from now, we will call health, because nobody call digital banking today. It's just bank. And because the banking sector transformed in such a way that today digital is normal. So to conclude my intervention, I want to just reiterate our willingness and capacity and desire to work together with all of you. And I'll say a few words in Portuguese. So estamos muito dispostos a trabalhar com todos os parceiros para usar a saúde digital como um novo processo que vai permitir que todos nós consigamos atingir os objetivos de 2030 que permitam que todos nós gozemos de uma boa saúde. Obrigado.